Hi, this is Dr. Divya Sundaresh. I'm an oculoplasty surgeon. I am a surgeon from Bangalore and I also work at Zamindar's Eye Center. Facial palsy is a condition where it causes one half of the face to droop. This can be because of a sudden paralysis of the facial nerve, a nerve which is arising from the bony canal near the ear and supplying the one half of the face. Now, there is some inflammation and swelling of this facial nerve resulting in its weakness. This is like having a stroke of only the face. Sometimes it can also be associated with a larger neurovascular accident. Commonly, patients will present with watering of the eyes, inability to close the eyes, leading to pricky sensation in the eyes, dryness. Will also have an inability to swallow. The cheek will be sagging, and that side of the face they'll not be able to chew their food properly. And when they smile, the mouth will be going towards the opposite side. Facial palsy is like having a stroke. So you need to attend the doctor immediately because it may be a sign of an impending larger cerebrovascular accident as well. But generally, facial palsy is not so problematic because it does resolve. But it's always better to see a healthcare provider so that you may not have further complications. So, facial palsy commonly occurs after a bout of flu. It can be caused by many of the viruses like influenza B, cocsakie virus, herpes simplex, herpes zoster. It is more commonly seen in older age group immunosusceptible people. It is also seen in diabetes, hypertension, and sometimes also in pregnancy and after the first week of delivery when they're very susceptible to develop infections. So, facial palsy generally tends to resolve within a period of 6 weeks to 2 months. But if it does not resolve, then it can lead to chronic dry eyes because of chronic exposure, because of inability to close the eyes. It can also lead to the outward turning of the lower lid, causing further watering problems. And it can also cause the half of the face to continue to sag and inability to chew properly. So, all these may require correction. So, treatment of in facial palsy has two parts, generally in the acute phase and then in the long term. So, in the acute phase, since the patient cannot close his eyes, there is risk that he will develop corneal infections, conjunctivitis. Hence, we need to use lubricating eye drops, especially while sleeping and especially when we're having prolonged screen time. We generally advise against sleeping directly under the fan or in the AC environment where the tear evaporation is more, making the surface more prone to develop infection. In case there's severe exposure during night time, then we advise lid taping so that the cornea is not exposed while the patient is asleep. Generally, facial palsy recovers in 6 weeks to 2 months. Now, in case there's not much of recovery, then depending on the severity, we need to decide what surgeries to perform. Now, if the upper lid is not closing adequately, then we need to use weights to close the upper lid, like gold or platinum weights are used in a surgical procedure where the upper lid is made heavier, helps in closing the eyelid. Now, when the lower lid is sagging or turned outwards, it needs to be tightened and we need to help so that the watering decreases. Now, when the lower half of the face is sagging, that might require a surgical correction as well.